Good evening, everyone. I'm Dr. Merrianne Burtch. Welcome to our oldies repeating a previously popular webinar. Unfortunately, our intended discussion tonight about finding the service in your pet had to be rescheduled due to health reasons. So we kind of pulled out of the archives something that really seemed to be popular and is important to me and near and dear to my heart, which is doing home exams on your pets. And really the goal is to just be aware and have some familiarity with them as their physique and a lot of their uniquenesses following lumps and bumps and things like that. So for those of you that might be new to BirchBark and what we do, BirchBark Foundation is an organization that's over 10 years old now. And what we do is we have three missions that we execute on the Central Coast. So Santa Cruz County, Monterey County, and San Benito County. And our first mission is pet aid gifts. So we help low-income people that are 3 times poverty level or below with helping urgent care for their pets. So pets who have a fixable medical problem that's an emergency or a life compromising issue. We work with veterinarians who discount the bill 25%. We ask the pet owners to come up with 25%, and then BirchBark pays 50% of the bill for making that dog's life pain-free or fixing the life compromising issue. And since January of 2022, we have saved over 208 pets. This year, close to 90 pets already. And I'm very proud of that role that we take in the community. Our second mission is pet loss support. So people who are grieving or anticipating grief due to the loss of a pet. We have no-cost counselors, and we are very proud that we've recently partnered with Shine a Light organization to provide up to 90 minutes a week of either group support with 8 people or more, or individual sessions with a licensed counselor to process the grief or anticipated grief of losing a pet, which those of us who've had the heart dogs in our past or heart cats know that that is a challenge for us, and also that it's not something that everyone in the society really accepts. So having a group of like-minded people is helpful with that. And then our third mission is education, and here you are tonight. And the goal with the education is that we make everyone the best advocate that they can be for their pet. And the goal is to have anyone who wants to learn more about how to advocate and know about current medications, current medical techniques for their pet, and options for how to get the best care. This is part of our goal, and to build a community around education and knowledge to advocate for our pets. So our education program, we've already had over 137 people sign up this year. And in our pet loss program, we've had over 131 participants in 2023. So tonight, what we're going to do is replay this oldie, and I'll just summarize the purpose there is I actually am examining my own pets on this recording. And we're going to first have an introduction on why someone would want to do home exams, what the purpose is. And then also we're going to have a cat exam, which is my cat Boris, and then review a little bit what we look for. And then we'll go on to a dog exam. And then we'll have time at the end for live questions and answers if you want to hold your questions, or you can write them in the Q&A window. And at the end of the presentation, I'll be happy to do my best to answer those questions. And so from the archives, we'll go ahead and start this recording of home examination of your pets. The first question is, why do we perform home checks? And a big part of that is that we want to be able to catch fixable problems early. So your own pet may have some subtle changes that if you're not scrutinizing, you will miss. And certainly I know I've found during physical exams when pets come in, things that owners hadn't noticed at home. And part of that is just making sure that you look. And many of you are already pretty observant pet owners. And please note that this is not intended to replace the annual exam with your veterinarian. Still taking your pet to the veterinarian is important, this is our goal of to say, let me know what normal is for my pet and let me get familiar with that so that I can notice when things change. And that's the point. Also controlling weight gain. So one of the things we want to watch that our pet doesn't get too skinny, our pet doesn't get too fat. And you can actually, you've probably heard the adage, you should be able to feel the ribs, but not see them from a distance. And those are some of the things that people will use to try and help determine whether weight's becoming a problem. The other thing you do with a home exam is teach your pet become accustomed to being touched. And you may, if any of you that have gotten kittens or puppies may have had your vet say, hey, as much as you can, look in their mouth, touch their ears, touch their feet, do these things that help them get used to letting you look, so that when problems happen, foxtails, ear infections, you're brushing their teeth is something you want to do, that you're already making them comfortable with that kind of tactile stimulus and that they don't avoid it. Obviously, some pets are more cooperative about that than others. So it ranges from pet to pet. So the first part is we're gonna do very much a home exam of my kitty Boris, and we'll go through the parts of that exam. This is Boris. He is my own cat and a great model for things like this. So when I do an exam, I mentally kind of say from the toe to the tail. So I kind of go in order when I look. So one of the first things I'll do is look at their face for symmetry. You know, if there's an eye that's winking or a side of the face that's swollen, then that's a signal that something could be wrong. So you want to see that the eyes are symmetric, and Boris's ears are going to go back when he doesn't like what I'm doing. But a quick look in the ears is a good idea. A quick look at the eyes, if you can get them to open their eyes. See if there's any discharge from the nose. And then if they'll let you look in the mouth, you want to see that there's nice, I just found that he probably has a tooth problem. Pink gums, and that the teeth look okay. So on this side, things look good. Not every cat will let you do this, but I like to look in their mouth, so I'll use their cheekbones to open their mouth and look back there, and I see that my cat needs some dental work. So that's what I'll do around the face. Then obviously at the hospital, I'll be using a stethoscope to listen to heart and lungs, which isn't an at-home option. But I do like to feel under their neck to feel any asymmetry or swelling. And then there's lymph nodes in that area too. So if there's something big that you feel, then that can help determine whether there's a problem. Otherwise, I try to look at the skin, make sure that there's no flea dirt or any weird masses. And a lot of times you can feel lumpy bumpies. And when we get to my dog, you'll see lumpy bumpies and what they look like. If they'll let you, rolling over and just kind of running your hands down their body. Boris really doesn't like me to comb his belly, but he'll let me do it often. So I'll just take a swipe down there and down the legs. If they'll let you look at the claws, that's a good thing to do, or between the paws, and quickly kind of feeling along the arm to see if there's anything that that hurts, any area that hurts, especially if you see that your dog or cat is laying. And you can do the same thing with them standing, just kind of feeling down the bones to make sure there's not an area that hurts. And then it's not a favorite thing, but looking under the tail to make sure there's no problems there. And then feeling along the tail as well. So I found out that Boris has a dental problem in his upper molar there with that exam. But otherwise, he seems like he's a pretty healthy. All right, so he is a healthy 14-year-old cat is what that video was meant to say after that. So now we'll go through each part of what that video talked about, and I'll give you examples of where you might find some abnormalities. These examples are pretty extreme, so it's not what you're going to see overnight at home, but I wanted to make sure everyone kind of understood what you might look for. So this is a dog with facial paralysis, and you can see if you kind of divide his face in half, this side has a droopy lip, the eyes a little bit more closed. So that's a nerve problem. And people, they call it Bell's palsy. So what happens is the nerves that innervate those muscles are affected, and so you get a droop. And that's a good example of asymmetry. Here's a kitty cat with an abscess on his cheek. Cats who are fighters tend to get bit. Either the ones that stand up for themselves get bit in the face. The ones that are trying to get away get bit in the back end. But you can see on this one that there's asymmetry in the eye because there's this swelling here that's an abscess on this kitty's cheek. And so that's some of the places that you'll see facial asymmetry. And then looking in the eyes, these are some examples of changes that can happen in the eye. Again, these are pretty extreme, but there's a syndrome called cherry eye. Dogs and cats have what's called a nyctitans, or a third eyelid that kind of comes up from the nose side. And when I'll try to show you that when we examine Stuart. But this is something that can have cartilage thicken or flip out. So this dog has actually gotten a flip of that cartilage in the third eyelid, and you can see that that right eye has this little cherry-like thing poking out. And then there's a cataract. So you can see that this beautiful picture of a lion that we found on the internet, and credit to that photographer, that the right eye has a cataract and a blue haze, and the other one looks like a normal eye. This kitty cat has a little bit of an infection in its right eye. So again, there's that third eyelid we just talked about. You can see it coming up a little bit. There's redness compared to this healthy blue eye here. And then glaucoma will actually show up as bulgy eyes. So that's a pressure change inside the eye itself. And those eyes will look bigger, and then they'll also get a blue haze because the cornea gets changed by the blood flow or pressure in that eye. So nose and mouth concerns, again, we're looking for symmetry, discharge changes when we look in the nose. So here's a dog with some nasal discharge. Those of you who've dealt with foxtails in this area know that you can get a bloody discharge, you can get a serous discharge. Dogs with a foxtail will sneeze a lot, so they have a lot of other clinical signs that will show when there's a problem. This particular dog has a fungal infection, and there's a pretty characteristic opaque discharge there. This kitty cat also has a disease called cryptococcus, which is a fungal infection that can change the architecture of the nose. And if you didn't know it was your cat and you didn't look at it every day, you might not notice this kind of change, because there are cats with handsome Roman noses that might look a little bigger normally. And here's a side view of a similar thing. So this kitty, the bridge of this kitty's nose has architecturally changed. And that's something to pay attention to. And that can be an infection, it can be a bacterial infection, fungal infection, other things. And unfortunately, architecture change in the nose can be more serious. And then looking in your dog's mouth, I thought this was a good video, a pre and post picture of dental cleaning, and really the pinkness of the gums and how irritated they look here. Obviously the tartar's irritating the gingiva. And after a dental cleaning, you see that the gums look a lot smoother along those lines. And so that's something that you can look for trying to figure out if there's a problem. Also, if they'll let you look in their mouth, then seeing any abnormal growths or changes in the architecture of their mouth is helpful. And again, I know that's one of the more challenging things to look inside the mouth. But there's some examples of abnormal. And then lumpy bumpies. So one of the things I wanted to do is quickly say, where are the lymph nodes in dogs and cats? So there's 5, they're symmetrical nodes, so there's 5 on each side. But where the submandibular, which, you know, when all of us were kids and we had a fever and our mom would be like, oh, let me check your glands. So that's your submandibular, and you'll feel them get swollen when you have an infection, especially if it enters through your respiratory tree. And then right in front of the shoulder, there's a lymph node called the prescapular, the armpits and the inguinal area, and then behind the knee, something called the popliteal lymph node. So those are places that people can just feel to see if there's abnormalities. This is a photo of a dog with a swollen lymph node. That's the submandibular lymph node. You can see that it's kind of directly down from the ear there. And then for cats, they can actually get hyperthyroidism. They can get changes in their thyroid. And this picture is actually a cat whose thyroid, people may call it a goiter. So it's a thyroid that's overactive and the gland has hypertrophied. So it looks pretty big. And that's something that you can find on your cat. You can have very benign masses in these areas too. So I don't want anyone to find something and immediately draw some bad conclusion. I have one kitty I treated with a very big benign sebaceous cyst on his neck for the last 10 years of his life. And it's not a problem. It just feels weird. So getting it checked out, documenting that it's not a malignancy or something serious,
That's part of why we're doing these exams, so that we can say, do I have to worry about this or not? Lameness is another thing. There's a bit of a fine art to it. Not being an orthopedic surgeon, it's not my one of my fortes, but one of the things you can notice is that a change in gait, besides the obvious holding up a foot, is that you can see in the head sometimes which leg is bothering the pet. So dogs with a front leg lameness will bob their head a little bit as they swing the lame leg sometimes. So if you start to see that your pet is bobbing their head more, or a cat that seems to favor them. And part of, I didn't cover this in the exams, but one of the things you can do is if you're looking and thinking, oh, I think one of the back legs is bothering them. Pets who have a lame leg, if you pick up the good leg and make them shift the weight onto the painful leg, they'll be very reluctant to let you do that. And so with my internal medicine skills, orthopedics aren't one of my fortes. During my examinations, if there's a lameness concern, if I pick up a leg really easily and the other one trying to pick up and the dog really won't let me, that tells me that they're trying to avoid shifting weight onto a painful leg. So that can help you figure that out. The more obvious things, this dog is toe touching lame in that left rear leg. And when it hurts to bear weight, they're going to do that. They're going to swing it around. And that's more of a motion thing, but you can certainly feel down the leg very gently. You have to be careful because you don't want to hurt your pet nor get bit if they have a fear reaction. So that's something you'll have to do with caution. And weakness is another thing that you can see. So here's a dachshund who's obviously had some paralysis or weakness in the back legs, and they're prone to intervertebral disc disease. And what happens is a disc will come up and compress the spinal cord and cause some weakness in the back legs. And that's something that needs immediate attention, either through rest or in some cases surgery. But this dog obviously is in a cart because of that. And then this kitty, this is what I call the plantigrade stance. So this kitty looks like somebody cut the high heels off their shoes. And part of that is something we see with neuropathy. Diabetes can cause that, and other types of neurologic issues with cats. So those are some of the things that can cause lameness. And then lumps and bumps, besides the lymph nodes that we went through, some other types of things you can see. This is a kitty cat with an ulcerated mass, and ulcerated masses are always a little more concerning than smooth ones that look like normal skin. This is actually a mast cell tumor, which are not as dangerous in cats as they are in dogs traditionally, but definitely a concern. And then here is a very benign wart. So this dog, this is just a little skin proliferation that doesn't have any pathology to it. So these are the kinds of things that I would recommend, watching. If you are nervous about, has it changed? That one of the great things about a smartphone is that you can take a picture of it and a month later take another picture of it. And you can also do things to objectively measure it. This is a cyst between the toes of a dog. Those of you who've had a dog with a migrating foxtail, that's what it'll look like. You can also get something called pododermatitis, which is just an infection. And because that area stays moist, it can be challenging sometimes to control infections there. And you can see how it almost looks like something wants to come out of it, like a rupture. And that's something you would find by examining them at home. And then this, which is a benign, it's what we call sebaceous cyst, and this kind of cauliflower appearance to it, is these warts that will happen in dogs over time. And so if there's that kind of cauliflower look, you may want to, certainly get to the vet, get these things checked, but it's not as dangerous as some of the other types of changes that you might see in the skin. And then this X-ray, or this picture, is very interesting because severe skin infections can look the same as, this is actually, unfortunately, what we call T-cell lymphoma. So you can get an unusual form of skin cancer, but it can look a lot like an infection. There's a lot of, it's kind of a Venn diagram. There's a lot of overlap, but you certainly wouldn't want to say, oh, this looks like an infection, let's treat it lightly, because one, the sooner you diagnose it, the better, but two, a skin infection is going to get better with the right treatment. And if it doesn't, then we have to look for other causes. So that's kind of wrapping up what we talked about, except we didn't talk about under the tail. Nobody's favorite part. So this is a very obvious picture of asymmetry in under the tail. This dog has an anal gland problem, and it would be something that you would see right away if you were doing the under the tail check, and would probably want to get that investigated soon. And scooting is another thing that people will see their dogs and cats do when there's problems with anal glands, whether they're impacted or infected or uncomfortable. They'll do a little floor scoot, and that's an observation you can make. And looking under the tail helps you figure out if there's asymmetry there. And then just looking at the skin. So you can get a dermatitis under the tail. You can get other things where the skin should look symmetrical. It shouldn't be red or irritated. And certainly not everyone likes to look at their pet's bums, but it does help catch things sooner if we do a quick, I call it under the hood check. So, all right, so now that you've kind of seen a bunch of abnormals, what we'll do is have you have a watch of watching a physical on a dog.
So now we've gone through some slides of what abnormal looks like, and we'll repeat this exam on Stuart. So same thing, nose to tail, try to start at the beginning. So take a look at symmetry. One of the things that I talked about with Boris is that you can actually look at the third eyelid, which is something people don't have, but if you push on the outer part of the eye, you can raise up that part of the eyelid. So looking for symmetry in the face, looking at the nose to see if there's any discharge, one side looking any different than the other. Also looking in the ears. Stuart spends a lot of time digging out on the hill here, so you can see some of our property in his ears, but otherwise he's doing pretty good. And then trying to look in the mouth, look at the teeth, make sure things aren't concerning there, not too much tartar, or that the gum line looks healthy. And then also, if you can, get them to open up their mouth and take a quick look in there. That was a quick look. Sometimes that's hard. Here, Stuart, let's give them a better look than that. Okay, good boy. And then after that, going down the chin, I feel under the angle of the jaw for any lumps or bumps, any changes in the neck, any those lymph nodes that we talked about are here under the chin, and then some under the armpit. And so just feeling along the body. Oh, yes, Stuart can see his treats from here, so he's going to complain a little. Let's put you the other way, buddy. So one of the things about Stuart is he'll be 9 this year. So he got some lumps and bumps here on his belly. You can see some irregularities, and these are all fatty tumors that we've examined. But I like to feel them and make sure they don't get bigger, that they don't get firmer, that I can still move them very easily. And then looking on the belly for any changes here of skin changes or abnormalities. Same thing with the bones. Take a feel, kind of a squeeze at each of the bones. And then if you have a dog that you've worked with, they usually will let you look between the toes. Make sure there's not foxtails or anything there, and underneath. If they'll let you do that in each foot, that will help. And then after, uppy uppy buddy. After they get up, come here, up, good boy, stay. Checking under the tail. So looking in the back for symmetry, change in muscles, muscle mass, if they see any lameness. And then I always try to kind of look under the hood and make sure there's nothing under the tail that's worrisome. All right, go. There goes his treats. Always give a treat afterwards. You want it to be a good experience for your pet. Thanks.
So thank you for attending our quick overview of how to do an exam at home. And now if you guys have some questions, I'm happy to try to answer them.
All right. Well, that was a while ago. Those videos were made. Stuart's now going to be 11 this year. So please feel free to click on the Q&A at the bottom of your screen if you have any questions, and I will do my best to answer them. You also can check the chat if you have any questions there. So it looks like we have, I like to think that I was very thorough and we don't have very many questions, but please, any question, anything I can do to help people feel more comfortable about that process. And I know I've been doing this for 35 years, so, and in the industry for over 40. So it's not so easy as those videos might make it look. So definitely getting into the habit, especially if you get a young dog or a young cat, getting into the habit of touching them a lot, looking at their face, looking in their mouth. And most veterinarians will encourage you to actually brush teeth. So getting into the habit of looking in their mouth, touching their paws, looking at their nails, all of these things that end up being a positive experience when they're young, where you're able to reward them with treats afterwards, or throwing the ball, or anything that is a positive experience, can help increase the opportunity for you to have a successful exam down the road. And there is a question here. Are there times that it's not recommended to aspirate a mass? I've heard about masses getting angry when aspirated. That is a very good question. And there's actually a really great oncologist that has, one of her lines is, see it and aspirate it to determine what it is. If we have a high suspicion of what we call mast cell tumors, and that kitty picture was a mast cell tumor, then you can release substances inside mast cells called histamine. And those of us with allergies are familiar with histamines and antihistamines that can make a mass more angry. So there's some predisposition for certain breeds. Boxers and Boston Terriers are a little more prone to it. So that is a place where the veterinarian usually would have a high suspicion based on its appearance and the breed. And sometimes we're surprised. So we do an aspirate and a mass might get bigger or swell. And we can look under the microscope and say, yikes, that's a mast cell. And we will actually treat with antihistamines and sometimes a dose of steroids if it's been triggered. Yeah, I know that there are also some types of tumors that are what we call tracking tumors, where if you let cells run through the body, are they going to plant themselves again? My understanding is that very few skin masses do that. We have seen that in bladder tumors, which is part of why we usually don't aspirate bladder tumors. And there's some really good new ways to diagnose bladder tumors, so that's less necessary than it used to be. So to answer that question, yes, there's times when you have to be cautious and prepared for a reaction or a cyst, or in some cases, bleeding. There are certain types of skin tumors called hemartomas, which are basically a conglomeration of blood vessels which might bleed. So these are things that we have to be prepared for, and that's part of why you want to be at the vet when you do the aspirates. Good question. And the next question is, any recommendations on how to get an older cat who adopted me used to looking into it, I'm assuming into the mouth, into things like that. She's 7 years old and a bit spicy. You got to love spicy kitties. My response to that is time and confidence building. So if this kitty has adopted you, obviously you've been chosen at some level. Then what you do is just slowly work towards it. So if she allows you to pet her head, maybe slowly close her eyes and open them again, or just pull her lip back. If you just kind of pull on one side in cats, a lot of times they'll let you do that. And then afterwards, whatever her positive reinforcement is, if there's temptation treats or greenies or something that she really loves, after she's let you do some of that, then give her that treat. The minute she gets towards spicy, and cats, the best way to tell if they're getting spicy is their ears go back, kind of like horses. So their ears are forward when they're really comfortable. When I'm examining a cat and I see that twist of the ears to the back, that means I've got to slow down and either give them less stimulus or give them a little space. So it sounds like you've made progress with getting brushed and combed. So I really think that you probably could very slowly work towards teeth and just, touching her teeth, then stopping, giving her a treat, and you move towards seeing if you'll be able to brush teeth. With cats, they make these little finger toothbrushes, which is great because you just have your finger go in there instead of having a tool to go in there. And sometimes that'll work better. So certainly feel free to type another question if I'm not adequately answering yours. And there's another question of saying, I can only brush my pup's teeth without toothpaste because with toothpaste, she won't be as still because she's wiggly and wanting the toothpaste. Is it beneficial to only brush without toothpaste? And the answer is yes, because it's the friction of the tooth of the toothbrush that you're looking at. Many of the toothpastes also have enzymatic substances that help break down the tartar. So in an ideal situation, you maybe even have some toothpaste on the brush, but not enough for her to try to eat it, because a lot of times the flavored toothpaste can influence them. But the friction is valuable in and of itself. And you may just, after you're finished, let her lick a little bit of toothpaste, or even rub it on with your fingers so that some of the benefits of the toothpaste can be there. But brushing with water is better than not brushing at all. So the answer is yes. If toothpaste becomes a distraction, then brushing without it and then rewarding her afterwards to try and make it a positive experience, and work towards, having just a teeny flavor, and see if you could work towards having some of the toothpaste on the brush. Okay, one of the other questions, and I think this is a good one, is if the your dog or cat is limping, how long is it reasonable to see if there's improvement, or rest it before pursuing diagnostics at the vet? And the first answer to that is depends on how severe the limping is. If an animal is completely non-weight bearing, which means they won't put their foot all the way on the ground and they're lifting it every time the body is asking it to bear weight, then it's probably best to go in sooner. And especially if there's any weird angle to the leg. And that in that case, you have to worry about some type of fracture. A good example of that is dogs that have a cranial cruciate tear. The ligament will tear, and those dogs will what I call toe touch. So they put a little bit of weight, but they come off of the foot as quickly as possible, because when you bear weight, it'll cause the knee to slide a little where that ligament broke. So if you know that your dog just went on a 10-mile hike yesterday and ran ahead and ran back and ran ahead and ran back, or something that was a higher energy activity, then 1 to 3 days of rest is reasonable. If you have a relationship with your veterinarian, or you have a pet that has had anti-inflammatories for previous lameness, you can potentially give one of those and then rest them and see how that goes. But if they have a persistent lameness for more than 3 to 5 days that is affecting their gait and their comfort, then I think it's time to get them in to see the veterinarian. So I think that's a very good question. And a lot of people also ask the question of, what is an emergency? And probably should do a whole webinar on what is an emergency. And those of you who aren't familiar with our YouTube channel, we do have Pet Emergency or Pet First Aid was our webinar in May of this year, and that is up on our YouTube channel. That was a great presentation by Lissa Richardson, who's a surgeon at Sage. So that's really valuable about when to go into ER and with what urgency on the heels of first aid needs. But this question about vomiting and diarrhea is a very good one. Most of the time, what I recommend is if your pet is not drinking and keeping down water for 12 hours, then they need to be seen because dehydration can happen really quickly. Dogs and cats can go a little longer without eating. So I usually say not drinking, 12 hours, get them in. Not eating, 24 to 36, as long as they're drinking water and they're not vomiting up water. But ideally, getting them in sooner is always a good idea, because there are so many diseases, obstructions, endocrine diseases that can quickly progress. So, for example, if I have a dog that vomits once, but is drinking water and otherwise feels fine, watching that dog for 12 to 24 hours is reasonable. If they vomit again, then it's probably a good idea to get them examined. If you have a dog that vomits 4 times between 8 a.m. and noon, or 4 times in a short period, that constitutes a greater emergency than if there was just the one vomit. And there's not just the vomit or diarrhea that you're looking at. There's also what's their attitude, what's their hydration. Is this a pet that's usually dancing all over and trying to get your attention, who's in the corner just lying down with lethargy? Because that means something is more serious. And pain also, like people can sometimes, especially if they've done home exams, can tell if the belly is uncomfortable. And so they might touch their dog on the belly or see that it's very taut. There's a syndrome called bloat, where the stomach will fill with air and it's like a basketball. And those dogs will try to vomit repeatedly and sometimes can't bring anything up. And their belly will feel like a drum. Usually happens to very large, deep-chested dogs. That's an emergency because the stomach can twist inside the abdomen and cut off the blood supply, and requires, decompression and or surgery to remedy that situation. So, and the other thing that came up as a question is, how often should you do home exams? And if you have the time in your schedule to do that, I would recommend that you do that probably once a month, especially if you have something you're following. So quite often, if I have a mass where we have an idea what it is, and whether we take it off is going to depend on its size and whether it inhibits the animal, then getting calipers from the hardware store or a ruler and measuring it. So you can say, oh, it was 1 inch on August 1st. Now it's 2 inches. It's doubled in 3 weeks. It's time for us to get a little more aggressive. And, if it's in the armpit of a pet, and it's going to change their gait, that's something even though it might be a benign mass, you might want to address it sooner rather than until it gets so big that it's in an area where it's difficult to do surgery, if that's your choice. So I'd say shoot for once a month, but if you do it 2 or 3 times a year, you're probably doing your pet a favor. If you have 5 pets like me, it's a big time commitment, but just because I'm trained in it, I'm pretty much doing exams on them all the time. Okay, another great question. A cat, this 7-year-old cat who adopted Deb, one of the question askers, is saying this kitty is not very good at drinking, and that historically her cats have been very good at drinking. This is a very common problem, and anyone who's dealt with cats who have urinary obstructions, and we want them to have very dilute urine, will not drink enough, and the more concentrated their urine is, the more chance that they can form crystals, and crystals can cause a problem with outflow, especially in male cats. And so increasing water intake is sometimes something we have to do, because cats they're almost like desert animals. They often don't choose to drink. So one of the solutions that people will use is a fountain, because some people will say that my cat will only drink out of the sink if I turn the faucet on, and wants to have a dripping source of water to drink from. So you can get little fountains that will, burble water and recirculate it, and cats often will be more interested in drinking from there than from a regular bowl. I have had people get those anticipating a great response, and then had cats just play in them all day. So I can't say it's a reliable way to get them to drink more, but it's something to consider. The other thing you can do is actually find a flavored water. So when I have a patient that I know needs to have a drop in the concentration of the urine, and I need them to drink more water, I'll either see if they'll drink soup. So have the owner add, say, a 1/4 cup of water to canned food or even dry food. So cats and dogs that are really good eaters, you can just add water to their meal. And on average, we want them to drink about 30 mils or 1 ounce per pound per day. So you can kind of guess, say I have an 8-pound pet and I want it to drink 8 ounces, and I know it doesn't drink any water and it has dry food, then I'm going to try to get 1/4 to 1/2 cup into them somehow throughout the day. If they canned food, that is a lot of moisture. So you probably only would have to work on 1/4 to a 1/2 cup for that pet. So a third thing to think about for cats, so you've got the fountain, you've got adding water to their food if they're a good eater. And some cats, if you put water in their dry food, they look at it like, what did you do to my bowl? So you don't want to do something that's going to make them not eat. And then the third is flavored water. So what I'll do sometimes is if people open a can of tuna fish, for example, you can take all the water from the tuna fish and put it into an ice cube tray. And then you've got flavored tuna water in the freezer, and you just take one of those ice cubes every day, maybe add 1/4 cup of water to it, and then try to make it a routine. Oh, it's drinking time, and have that kitty get the flavor of the tuna water and being interested in drinking because of the great flavor. And then you kind of make it a ritual, if you will, so that you can get her to drink once or twice a day. So that's what those 3 steps are what you can try. So a fountain, or see if you have a kitty that'll drink out of a sink. Not everyone loves that because you end up being a servant to your cat when they want to drink from the sink. Adding water to the food, and then flavored water. And Marguerite has another question. And her question is about pups getting into marijuana. So knowing the symptoms is important. Her question is, her 5 and then 6-month-old dog has ingested marijuana twice, and how do we address that? So it depends on how much they get. And now that it's legal, it is certainly a little bit more of a common emergency visit. And we use some of the urine tests for toxins when we think a dog has a toxin that is not explainable. But dogs who get into marijuana, they get really hungry quite often. Almost always they become urinary incontinent, so they'll just dribble urine, and they'll act really odd. And quite often you don't know it. They picked up something at the beach. I have a patient that got into methamphetamines twice, and nobody really knows where he got them. And probably one of my first cases of marijuana toxicity, the dog was classic for it. And this is back in the 90s when it wasn't legal. The dog had gotten into the neighbor's garbage and eaten the butter that they had used to make brownies, and had gotten a pretty good dose of marijuana. So we had to do some detective work to figure it out. It was before we had the urine tests. So it's the level of disorientation, the level of not wanting to eat or drink, and sedation that would make me say, you need to bring them in. So if they get dehydrated, they're not drinking enough. If it's really mild and they're not dribbling pee, you may be able to let them sleep it off. One of the things that the emergency clinics can do is, if it's recent ingestion, they can help them vomit, so the total body dose is less. They give charcoal, which is an adsorbent for toxins, so that does help quite a bit. So if you know the symptoms and they're very mild, you could monitor it. But if she or he is dribbling urine and really out of it, then you really should get some help. And okay, there's an addendum to that question of that the first time in, they were able to wait out the symptoms and didn't have to ingest the charcoal or any other treatment. So it sounds, Marguerite, it sounds like you've been through the less intense event. And yeah, that's, for example, people use chocolate as an example, as a thing to try to figure out when do you take them to the vet. And the answer is, depends on what kind of chocolate and how much your pet weighs. So there's actually something online that you can look up called the chocolate wheel. And you can basically say, my dog weighs this much, and it got 1 pound of dark European chocolate. And a lot of times the wheel will then say, you need to go in right away. Chocolate has a caffeine-like substance in it that can cause the blood pressure and heart rate to go through the roof and get dogs really, really sick. And unfortunately, I can remember one case, the dog belonged to a veterinarian, and they had brought, Swiss dark chocolate home, and we couldn't get that heart rate down on that dog. So it is risky if you have dark chocolate and the chocolate wheel says go in. Different kinds of chocolate, white chocolate, milk chocolate, peanut butter cups, they're going to be a little bit different. So that's a good resource to know about. Here's another good point. Somebody says, I find sometimes that my abnormality observed at home does not manifest as soon as I bring my pet to the vet. Do you have a recommendation for how to deal with that issue so I don't look like a Munchausen by proxy? That is a very entertaining question. And the answer is your smartphone. So I recently had a case of a dog who would have these episodic breathing abnormalities. And when the owner came to see me and was trying to describe it, I said, gosh, I wish we had a video. And she said, I do. And she pulled out her phone and she showed me a video that was very clear, what kind of gave me a very clear idea of what was happening and where it was affecting her respiratory tree. And I had to still put some puzzle pieces together. But a very good thing to do is, if you can, pull out your phone. I would say that, and videotape what you're seeing. The orthopedic surgeons actually now videotape and then slow-mo some of the dogs walking to really figure out where their lameness is. And I know in my career, whether something is a seizure versus a fainting episode versus something else, like a toxicity, can really be determined by a video, because there's some characteristic signs of focal seizures and other things. So the answer to your question is try to use your smartphone to take pictures of things to help decrease the chance that you might seem that you're overreacting, or so that your vet can see what you see at home, that sometimes adrenaline will mask those signs when you bring your animal your pet to the vet. Okay, great questions, really great questions. And I do think maybe someday we'll do a little bit of, what constitutes an ER visit, so that we can help people have tools at home. I think I have a blog on that, but an interactive session might be great. So thank you everyone for coming. And if that's all the questions, we can wrap up, and I can say thank you very much for supporting us, for being an advocate for your pet, and doing what you can to create the best human-animal bond and maintain it with joy. All right. Good night.